Parkinson's disease is a devastating disorder that results in over 100,000 global deaths per year. It typically occurs in those over the age of 60, and is also more common in males than females. Parkinson's disease has many symptoms, with shaking, slowness of movement, and difficulty walking occurring early on in the disease, while dementia, depression, and thinking and behavioral problems happening in the more advanced stages. Parkinson's disease results from the death of cells in the substantia nigra, a major part of the brain's motor circuit in the midbrain. This results in too little dopamine in the region, as these cells produce dopamine. This deficiency causes the symptoms of Parkinson's. The disease is usually identified by the symptoms and also using neuroimaging. Unfortunately, there is no existing cure for Parkinson's disease. However, there are still treatments. Initial treatment includes the drug levodopa, which develops into dopamine as it enters the brain. There are also other drugs that are used if levodopa is not effective. In severe cases, where drugs are ineffective, deep brain stimulation is sometimes used to reduce the motor symptoms. Deep brain stimulation is a form of neuromodulation where surgically implanted electrodes are used to target and stimulate specific areas in the brain to treat Parkinson's disease and other disorders like it. It has been approved by the FDA for treatment of Parkinson's disease. Most commonly, deep brain stimulation is used to stimulate the subthalamic nucleus and the globus pallidus interna, which are both important in the motor circuit of the brain. There are also less commonly stimulated sites. Deep brain stimulation is not a cure for Parkinson's disease, and it's still only used in severe cases. Its effects are still debated, and holds the risks of major surgery, including the risks of hemorrhage and infection. The magnitude of these risks are dependent on the experience of the specific surgical team responsible. Parkinson's disease still has no cure, but much progress has been made, and much is still left to come. Many new drugs show promise in providing better treatment options for those with the disorder. Deep brain stimulation holds much promise as the brain's anatomy and physiology becomes better studied and surgical techniques and precision increase. Hopefully, with these new and developing treatment options, Parkinson's devastating effects will soon become much less prevalent than they are now.